Hello, my name's Simone. Um, Welcome back, I guess.
Yep, I'm Subhas Pradhan. Welcome back.
I know that we said that we'd have the next installment of our psychiatry series, but today is a rather special day. It's mental health, World Mental Health
Day, yeah.
Awareness Day, and
Mhm.
um, I think that this is a pretty important thing to talk about, so that's what we'll be discussing for today.
Mhm.
So, as our in-house guest speaker, um, what would you describe, or how do you describe mental health in general?
All right. So first of all, thank you, Simone, for asking me to be your regular guest. And yes, today is the World Mental Health Day. All right. So we thought of doing a discussion on this topic. And coming particularly to your question, yes, mental health is defined by World Health Organization as a state of well-being in which uh, people have they have few things. One is sort of I jotted down. A person is able to realize his or her potentials. That is one. Second, they are able to cope with the normal stressors or hassles of life. Third, they can work productively and fruitfully. And fourth, last and not the least, they will be able to contribute meaningfully to the society that they live in. So these are the different components of mental health that has been the way that has been defined by World Health Organization.
So I get that, get what that is, but why exactly do we have a specific day for it? Like, what makes it that important?
Well, I mean, yeah, that's a question. I mean, mental health is there. It should be operating every day. What it's like having a Father's Day, Mother's Day, Rose Day. So it is a day to concentrate or focus our attention on those issues. Although ideally and in reality, it operates every time. Mental health is very important aspect of our life, isn't it?
Mental health is a rather stigmatized thing to talk about. How exactly did this get started, this whole celebration thing?
I think it has got a history. 1994, if I'm not mistaken, um, by World uh, Federation of Mental Health. They thought about having a day which would be, as I mentioned, would be sort of concentrating the efforts of the society to focus on mental health, especially to dispel the stigma and all those things. Mental health has been shrouded by various other negative publicity or the bad press. So they thought about having a particular day so that government, non-government organization can focus their attention. And later on, World Health Organization endorsed their proposal. So as you know, I mean, in this context, I must tell that health has been defined by World Health Organization as a state of complete physical, mental, and social well-being, not necessarily the absence of disease or deformities. So mental health is an integral part, or you can say sine qua non of global health or holistic health.
Well, I'd imagine that uh, it, this year's theme is a bit different from the others. Aren't there like themes for each day?
Yeah, yeah. I mean, all years, as you know, they have different themes, right? Since its inception in 1994, the themes every year has been sort of given a theme. So this year, the theme is mental health in an unequal world. That's bit very pragmatic one. It shows that mental health, the availability, the access to it is not equal in all parts of the world. Like health, which has been sort of sometimes criticized as a purchasable commodity, mental health is also accessible not to everybody in the way it should be. So, in fact, the statistics tells that up to 75% to 95% of populations in the lower socioeconomic status in low income countries, they don't have access to mental health. That means even if they have got mental health, they have to suffer in silence and they will be victims of the social prejudices, stigma. So that's the reason probably World Health Organization wants us to focus on this aspect, the unequal distribution of mental health sort of resources.
There is, in fact, a sizable amount of people, especially minorities, who aren't able to access mental health, from women of color to, like, again, people from low socioeconomic backgrounds. A wide range of people haven't been able to access health by what I believe is called barriers.
Yeah.
So, like, let's focus on maybe a specific group, like women, for example. How easy can your average woman like access mental facilities or help for their mental health?
Yeah, I mean, I'm glad that you asked that question. It's really important and it's also a hot topic for discussion. The other day we visited one of the school sort of, the psychology programs. I sort of came across the women's mental health. So I was a bit sort of intrigued, but for the sake of our discussion, it's easier to approach a particular problem if we divide it into different chunks. So as you mentioned that different groups, ethnic groups, groups divided by gender, groups divided by the age, groups divided by location or socioeconomic background, they have got peculiar or unique mental health issues. Coming to women particularly, most of the epidemiological studies have shown that women are more prone to have common mental illnesses like anxiety and depression. In fact, consistently it has been shown that people, those suicide, for example, women attempt more suicide, although men at the end they sort of commit or they actually kill themselves by suicide more.
Yeah.
So there are various multiple complex causes of that. So it is important to focus on a particular group so that we can approach that group or help that group in a better way. It doesn't mean that we are undermining other groups, but sort of saying that we are not missing any particular groups and their unique problems.
You mentioned something called epistemology. Could you expand on that?
Epistemology. Yeah, I mean, this is, I think epistemology, I made about epidemiology, not epistemology. I meant, yeah, epistemology more of a genetic sort of construct. So that's something we have to keep in the mind. So epidemiology, I mentioned, particularly in certain groups, it is important that, for example, I showed about gender, all right, male, female. I just gave you some examples. So also different demographic sections. So for example, people having say elderly people have got a separate set of mental illnesses compared to younger generation, for example. Okay, people from as I mentioned earlier, certain socioeconomic strata, they have got different type of mental health presentations than others. So there are some common factors that cuts across all those barriers, but there are some unique factors also that are unique to those particular groups.
Well, I have a bit of an off-topic question
Yep.
to ask, but I think a while ago you mentioned how different races or people from ethnic backgrounds might suffer from mental health issues. And that brings up the question, how exactly are doctors and healthcare providers supposed to like consider race?
Okay.
Because to elaborate, I know that there used to be quite a lot of practices from a long time ago where then consider different races to be more prone to certain mental health disorders. And now I think a large portion of people, today at least, now believe that people should be treated equally when it comes to their mental health. But I think it's still important to understand a bit of that racial trauma that might impact how a person feels on a day-to-day basis.
Yeah, I mean, it's a very complex, rather convoluted question, I must say. It's because, yes, we know that different races or people from different cultures have got different types of mental illnesses, all right? But in another way, if you look at it, maybe they have got the similar mental health issues, but culture influences the way it is manifested. I'll give an example. I was working long ago in Australia, in Queensland, in one of the indigenous dominated area. Okay, they had a range of mental illness. Obviously, they had schizophrenia, anxiety, and depression. But the way they manifested it was different. For example, their way of manifesting anxiety was much different than an average Western someone from the Western background would be manifesting it. The way they thought of, for example, they expressed their guilt was much different than others. For example, some people in that area, I came to know about it, they used to pierce themselves. Like suppose they did some sort of thing which is not accepted by the society, they will be piercing, like somebody will be having a spear, it will pierce certain part of the body. And the masculinity or whatever you tell that, or the ethnic background that expects you not to flinch when you are being punished. So the way of expression of mental illness, physical sort of issues, they differ from race to race. So from that point of view, it is important to realize not only it can manifest in a different way, but even the treatment has to be culture bound or culture specific. The whole branch of culture bound I mentioned, the culture bound syndromes, culture specific treatments are discussed in various psychiatric forums.
Yeah, so it's important to understand the cultural context someone might be coming from.
Yeah.
Well then, a bit sorry for taking us off course, but
Yeah.
back to Mental Health Day. How would you say someone might celebrate it, or at least become more aware of it?
I think it's not, celebration is the not right word. I mean, some people tell Happy Mental Health Day. I don't know what exactly is meant by that. Maybe they say it's a misnomer. It's not celebration. It's rather being aware. Being awareness is a more important aspect. So yes, this is the day we should be aware of mental illnesses, like the program we are doing. Hopefully some people are watching and they are also observing us, that it is important to realize that people, when they are mentally ill, they may not have access to resources. They in fact do not know many times that mental illnesses are treatable. A majority of the mental illnesses are treatable. If not treatable, at least you can do something for them. We may not be able to sort of cure some of the mental illnesses, but we certainly can manage it. We can reduce its intensity. So that is one way of sort of popularizing or making people aware. Second thing is that if possible, if you can, because the mental health people, mentally ill people are often discriminated. They are very poor persons in the society. Maybe if you can contribute to some mental health charity by your time, by money, by your kindness, those things will go a long way towards early detection and treatment of mental illnesses.
Okay? Right, and again, you mentioned mental health among the elderly, and I do understand. I can't remember which study it was specifically, but someone stated that as people get older, especially when they move into homes alone, they start to interact with people, other people way less. And could that be one of the factors that affect old people's mental health?
Yeah, I mean, really, it's a very pertinent question, I must say. One of the signs of mental illness or mental health is that you are communicating with other people, you are interacting with other people, and that is one of those unique features of a mentally healthy individual. Old people, by virtue of their old age, social structure, they are isolated. Isolation is a very, what do you call that, is one of those key criteria, you must say, to which probably comes along with old age, and that leads to lots of mental and even physical illnesses. There is a common myth that mental illness and physical illness are different. No, some of the factors that lead to mental illness also contribute equally to physical illnesses. So it's important to know those mental illnesses considered as one of those chronic illnesses. By definition, most of the mental illnesses are long term, morbidity is prolonged. So similar factors operate. So loneliness is one of those very important factors. Unfortunately, due to COVID again, loneliness has become almost endemic in the society. So that is something to be kept in the mind. Elderly people are lonely, but modern technologies, modern ways, and there are different things that we can do to remove their loneliness, or at least we can reduce it.
It really is such a shame that people who usually have so much to talk about, especially given their age, often end up isolated. And I think it's just wonderful that we do have technology that allows us to talk even across whole continents.
Yeah, I think that's a paradox, isn't it? I mean, like there is a saying that when an old person dies, an entire library dies with it. It's like an African proverb. Instead of learning from their experiences, their knowledge, we basically discard them. We want to literally reinvent the whole wheel again. And that's what the aim. If we can do something to reduce their loneliness, it will go a long way towards treating their mental illnesses.
All right. You mentioned something about barriers. And from what I know, barriers are anything that stop you from accessing a service. Are there any specific ones when it comes to mental health? Like, I'm guessing surrounding your normal socioeconomic and physical stuff.
Yeah, in fact, you mentioned quite a few then. Yes, there are one more important thing is access. To have access, we should be able to have a facility which is conducive for people to access the service. One of the major problems in low income countries is that they don't have sufficient mental health workers, clinicians. In fact, mental health clinicians are just saying among the psychiatric community is that they are like one extinct species. they are very less number of mental health clinicians are there per population, especially for low income countries.
LICs and stuff.
Yes. So one thing we are talking about in this like the theme of today, that unequal distribution is very much evident in this sort of scenario, that where people cannot access because they simply cannot afford to do that. In fact, one practical example, say mental health insurance. People for physical illnesses, very often we get various forms of insurance, but for mental illnesses, insurance companies are a bit tardy. They're very slow in approaching it, and that is there probably in all countries, maybe a little bit more in low income countries, but in the high income countries also that's a hot and debatable topic.
Like medical insurance by itself is already pretty flimsy for some people.
Yes.
But mental health and the money for it is even harder to access.
Absolutely.
And I think that kind of brings our discussion to a close, doesn't it?
Yeah, I think that's all sort of probably you can discuss in the limited amount of time. But the message summary, I believe, is that it's important to realize that mental health, like physical illnesses, we can do something about it. There should not be an era of or an atmosphere of pessimism around it. And we have to be specifically careful about this unequal distribution of mental health resources. So thank you everybody for watching us, and until we see you next week, have a nice day.